is Margie. I live in Michigan. I have a multitude of jobs. My day job is working for Antrim County as a secretary, but my year-round job is owner of a bike business in Bel Air. I'm also a very busy mother of two, and I had the iFuse procedure in 2022. It was February of 2018. I was leaving work. I slipped and fell and landed like a cartoon character right on my tailbone. So I went to the chiropractor, and that's where we discovered I had a herniated disc. I went to the hospital, and from there I started seeing doctor after doctor, general practitioner, sent me to a neurologist, who sent me to a physiatrist, who sent me to physical therapy, and back and forth. Looking back on this whole journey, it's easy to see that my work was very strongly impacted. I could barely sit, I could barely stand. I was in constant pain, which made it hard to concentrate. As it got worse over the years, I became unable to participate in family activities. I couldn't go biking, I couldn't go kayaking, I struggled hiking because I could barely walk. And so it was just this cycle of not being able to function properly. After dealing with the herniated disc for 3 years and it not getting any better, my neurorehabilitation specialist determined that the problem may also have been in my SI joint and that I may have some SI dysfunction. So she recommended surgical consultation. That is when I saw Dr. Molinari.
Hi, I'm Alexander Molinari. I'm an orthopedic spine surgeon, and we're here today to talk about sacroiliac joint dysfunction. So the sacroiliac joint is located at the base of the spine, where the sacrum or tailbone connects to the rest of the pelvis. In my practice in evaluating patients for low back pain, about 1 in 5 patients will have some component of sacroiliac joint dysfunction. In post-lumbar fusion patients, that number can even be higher still as more stress goes through the sacroiliac joint after spinal fusion that ends at the sacrum. When I'm evaluating a patient for sacroiliac pain, actually in my experience, one of the first things that clues me in on this is when I walk into the room, oftentimes patients will actually be standing and they won't want to even really sit down throughout the examination. One of the most important aspects of evaluating patients with sacroiliac joint dysfunction is, first of all, their history. One of my previous mentors always said, a patient will tell you what's wrong with them if you just listen to them, so that's something that I always try to strive for. The other thing that's also very important is a good, thorough physical examination of the patient. There are several tests or provocative maneuvers that can give you an idea that a patient is experiencing a sacroiliac joint dysfunction. Once a diagnosis of sacroiliac joint dysfunction is suspected, the confirmation of that is with sacroiliac joint injection. And just because someone has been diagnosed with sacroiliac joint dysfunction does not mean that they need to undergo surgery immediately. There are often various non-operative treatments such as physical therapy that can really assist them along the way. Once a patient's been diagnosed with sacroiliac joint dysfunction and they've gone through non-operative treatment, as they continue to go through their daily life and notice significant restrictions in their ability to perform their daily activities, that's when we really start to look at options for surgical intervention. In my practice, I've selected the SI bone iFuse implant for treating patients surgically for sacroiliac joint dysfunction. And the purpose of this implant is to halt the abnormal motion that's going through the sacroiliac joint. Additionally, the osseointegration that occurs over time across the implant itself further cemented my decision to make the choice to select that iFuse implant.
When I got home after surgery, I was still kind of drugged up from the anesthesia. The next day, it was like magic. It was like I'd never fallen. 3 months post-op, Dr. Molinari gave me clearance to ride a bicycle again. When I was able to get on a bike and sit down and pedal that bike, it was like I was reborn. When we went on vacation before surgery, it was all I could do to walk. And so now I can walk. And it's not without it. I don't have to hide anything. I am not in any pain. And I can participate, and the memories are actually real. They're not They're not jaded, they're not tainted with pain. Dr. Molinari and Diffuse gave me my life back.
If you are experiencing low back pain or any of the symptoms that we discussed here today, I would encourage you to come in for a complete evaluation of your symptoms. I'd love to be able to take care of you.